Hi, everybody. Welcome back to Two Nurses, One Podcast. If you're joining us from last time, thank you so much. Thanks for coming back. We enjoy having you here. We hope you enjoy this podcast as much as we enjoy making it. It's been a lot of fun so far. If this is your first time, just so you know, we are Two Nurses, One Podcast. We are two live in the flesh practicing male nurses. We are taking healthcare topics of the day, doing a deep dive, and adding that little bit of nursing perspective to kind of give a different voice to the popular healthcare discussion. My name is Chris. I am a master's level nurse. I specialize in oncology and clinical education. And then, of course, my very intelligent, very handsome counterpart, Dan. Say a little bit about yourself, if you will.
Hi, folks. Nice to see you. I'm Dan Clinton. I'm a registered nurse. I specialize in pediatric home care, and I'm also a professional nursing tutor. I help people succeed in nursing school and then pass the nursing board exam.
Very successfully, I might add. I am not only a president of the podcast, I'm also a user of Dan's services. Went through
You're
his
making me
NCLEX
think of
review.
made me think of the hair club for men. Like I'm not only the president, I'm the client.
Exactly right. That's kind of what I was going for. So yes, a very excellent review course, even if you're just trying to brush up before your NCLEX test, which of course is the big hurdle to getting into nursing practice, the nationwide exam. So if you joined us last time for our discussion on vitamin D, we do actually have some quick updates. Last time we discussed the immunological and health benefits of vitamin D. And today, Dan's going to give us a little bit of a follow up on what's been happening lately, particularly in terms of treating COVID-19. So, Dan, if you will tell us.
Yeah, so it's been about 2 months since we last filmed our podcast. And at that time, there had just been a couple very preliminary studies finding an association between more severe disease with COVID and vitamin D deficiency. And now there's a multitude of studies. It's like one of those things you wouldn't even have to put a footnote after that statement anymore. It's really commonly accepted that low vitamin D levels are a predictor of mortality and the need for ICU admission in a more severe course of COVID at the very least. And so some nations like Israel and Britain actually feel like there's sufficient data that they're recommending vitamin D supplementation to hopefully prophylax, like to prevent against COVID and or to hopefully at least decrease the severity of the disease. And what we talked about in that vitamin D podcast, one of the suggestions I made for future research is to actually prospectively study different doses. And let's give some of these researchers in Britain a little bit of credit because that's exactly what they're choosing to do. So Britain is actually doing a prospective study where they're sending some people 400 international units of vitamin D3, 800 international units of vitamin D3, and 3,200 units of vitamin D3. And then they're going to look to see if these people catch COVID or not. And so that's actually a pretty well designed, clever prospective study studying different doses that could help tease out, is this vitamin D just associated with increased mortality because it's sort of serving as a marker of ill health, or is it causal, in which case the vitamin D supplementation would hopefully have a preventative effect on catching COVID-19 and then a more severe illness.
And then are they researching it also as a direct therapeutic to people that already have symptoms of
And
COVID?
so there was one study
I'd
that
be
came
interested in
out
that
of
as well.
so there's one study that came out of Italy. They used the form of vitamin D that's already been metabolized to the liver. It wasn't quite a like randomized. It wasn't a placebo-controlled study. What they did is they did the currently best available treatment versus the best currently available treatment plus vitamin D.
Oh, okay.
And that was another suggestion for future research, that it's really easy to study vitamin D as an adjunctive treatment. We're not saying, okay, like don't give people an SSRI for depression, but try an SSRI plus vitamin D versus an SSRI versus a placebo. And so with COVID, it was one study. It was very small. It was only 52 patients, but I'm forgetting the exact numbers. But they found a dramatically lower number of patients treated with vitamin D ended up needing ICU admission, and none of them died. I feel like it was 1 versus 26, but I'll put a link. I wrote a newsletter on it recently
Interesting.
where I broke that down. So we'll put a link in there highlighting that research.
Yeah, and we'll be kind of tracking that as we go because I'll be very interested to see. Finally, we're getting to see something as simple as a vitamin supplementation using as a direct therapeutic. We've already established a wide body of research showing that it's an excellent preventative measure to other healthcare outcomes. But really, this is kind of the first time we're getting to see head to head, treating an actual disease or disorder with the vitamin D. That's going to be great. So anyway, so moving on. So stay tuned for that in the coming weeks. We'll be tracking that story closely. But today we want to talk about a little bit of different topic. Today we're going to be tackling type 2 diabetes, specifically type 2, because as we're going to talk about, it's really not an actual disease, at least in the traditional sense. It's really just more of one of your body's mechanics kind of gone awry. And we're going to discuss a little bit about what we think about we can do about that. So why don't we start off, Dan, with just a little bit of an overview of what type 2 diabetes actually is, and maybe just a little bit of how it differs from other forms of diabetes.
Sure. So diabetes mellitus, if we really go back to the Latin, diabetes means flow of water and mellitus means sweet. Because what happens is patients' blood sugar goes high and they actually start peeing sugar out in their urine, so their urine would become sweet. Way back when, what helped people figure out diabetes mellitus was insects gravitated to the urine of diabetics because they were actually peeing out sugar. And sugar is fuel for our body. It's very valuable. So we should never find sugar in the urine.
There's
So,
even some folklore that old school doctors would taste the urine.
and because there's a different condition called diabetes insipidus, which is where you're peeing a lot because the hormone that tells your kidney to hold on to water, antidiuretic hormone, isn't working. Insipid means sour. So diabetes mellitus, oh, your pee is sweet. Diabetes insipidus, oh, your pee is sour. Insipid is one of my favorite adjectives. It's like everybody's got that one insipid coworker that we can all think of. So especially in a nursing unit, there's always that one just
At least.
sour,
At least.
mad at life person.
At least.
It's like, it's not the new graduate's fault that you're miserable. Like,
Yeah,
talk to
right.
your
Exactly.
ex-husband, Cheryl. So
You've been doing this 30 years. It's time to retire, for God's sake. Let it go.
So, but diabetes mellitus, there's actually a lot of different types, and it's worth remembering that because we always talk about type 1 and type 2, but there's actually more. There's something around like 100 different types of diabetes. So type 1 diabetes results, it usually shows up in childhood or young adulthood, and it's autoimmune process, and nobody knows exactly what triggers it. It's probably multifactorial, that there's like a bit of a genetic predisposition, that a virus might trigger it. And then what happens is your immune system attacks and destroys the beta cells of the pancreas that produce the hormone insulin. And what insulin does is it takes the sugar from your blood and facilitates its movement actually across the cell membrane into your cells so your cells can use it as energy. So insulin lowers your blood sugar by taking that sugar from your blood and moving it into the cells where it can be used for energy or stored. And so type 1 diabetics, after this brief honeymoon period, they'll always be insulin dependent. They'll always need insulin because after a period of time, their beta cells are either destroyed or continuously suppressed so that they just don't make insulin. Now, type 2 diabetes, like Chris inclinated, when we say that it's not really a set disease, we're sort of deliberately leading with a controversial statement. But the argument that we're really trying to make isn't that type 2 diabetes isn't real, but more so that it's really just a somewhat arbitrary definition restating that the client has a high blood sugar, hyperglycemia. And so there's nothing intrinsically wrong with that definition, but the problem is it makes it sound like it's external and that it's fixed and immutable, like it can't be changed. And it also, when we think, oh, there's this external disease that's just going to get me, we're not really thinking in terms of primary prevention. And there's a lot of modifiable risk factors, and that's what we're really going to focus on today. There's a lot of things we can do to decrease our risk of diabetes. Now, with type 2 diabetes, it's really more that the blood sugar just trends up over time. And it isn't so much that the pancreas isn't making enough insulin, it's that the body has grown numb to insulin. It's become resistant. So it's more so a disease of insulin resistance than hyposecretion. That's a little bit controversial, but studies have found that most type 2 diabetics, when they're first diagnosed, actually have higher than normal insulin levels, which would suggest that the problem really isn't that they're not making enough of this hormone, but that it's lost its usefulness from essentially overuse, from having to continuously lower our blood sugar. Our cells have just become numb to insulin, and it's not working like it used to, resulting in a high blood sugar.
So I think for the average layperson, and that's an important distinction to make, Dan, because that can lead to several barriers in terms of how we think of it. Like you said, more of a primary prevention or a lifestyle modification as opposed to other more traditional treatment pathways. But it is an important distinction. So think of it this way: everyone's been on, for the most part, a prescription medication for something at some point in their life. And just like your body can get used to certain medications to the point where you have to keep taking more and more of it to get that same therapeutic effect, insulin is working similarly in your cells. To get that same energy production, it is now needing to pump more and more insulin into your cells because, as Dan says, those cells are getting numb to the insulin, so they're not going to take in the sugar and make that energy. They're just saying, there's way too much here. We're tired of doing our job. We're just not going to do it anymore. So that's a very important distinction.
And there's this weird kind of paradox with diabetes that can be confusing for people to understand. So if insulin takes the sugar from the blood and moves it into the cells, you can have somebody and simultaneously their blood sugar is high, yet their cells are starving.
Right,
So at the
exactly.
same time, your blood sugar
Exactly.
is high, but there's cellular starvation because none of that sugar is moving into the cells. So the reason the blood sugar is high is because insulin isn't doing its normal job and actually moving that sugar into the blood.
And I think it's important to note that insulin resistance is a normal function of your body. Your body is actually doing its job. It's a mechanic that it's meant to happen. But because of the lifestyle of the overconsuming of carbs and calories, this mechanic is now broken, basically.
So that's sort of the argument we're making, that this normal homeostatic mechanism is kind of getting worn out from overuse. And so if we think of type 2 diabetes really more so as just hyperglycemia, that gives us more targets, both for its treatment through lifestyle interventions and through primary prevention. And we're really going to focus on preventing diabetes. Just in a lot of the advice that we're giving would overlap with treatment. But when somebody's also taking medications to lower their blood sugar, if you then start adding in other interventions designed to lower the blood sugar, your blood sugar could actually get too low. So treating diabetes in and of itself, I think one of the challenges, and this is something patients will say all the time, and it's true, treating type 2 diabetes gets very complicated quickly. There's broad consensus that metformin, trade name glucophage, should be the first name oral hypoglycemic. There's some problems with that now, not any problems with the medicine itself, the active ingredient, but they've actually found a lot of batches of
Mm.
metformin are contaminated with these things that become carcinogenic over time. So there've been lots of recalls, which is unfortunate because really in general metformin seems to be a very good drug, and one benefit of it is that it carries a very low risk of symptomatic hypoglycemia. So when you're designing a drug to lower someone's blood sugar, if you can have a drug that lowers your blood sugar but doesn't make it go too low, that's a
Mhm.
huge plus. So what's tricky about type 2 diabetes is in the best practice guidelines, there's broad consensus that metformin should be the first line, but then there's this real divergence about what should be second line. So even at the second line treatment, there really isn't one answer. There's a lot of different paths you can go. So you'll often see patients say, like, no two doctors treat this disease the same way. And that's really true. So that's one of the reasons also why type 2 diabetes gets very complicated.
It can
So
be
our
very
focus
nuanced.
so our focus today is to really understand the definition. We are going to make the argument that the nursing diagnosis, hyperglycemia, is actually a more adaptive way of thinking about it. And then what can we actually do to try to prevent diabetes? And really, why did we want to focus on this? You really don't want to have diabetes. It's not just mortality. It's not just that it's going to very likely shorten your life expectancy. It's having to think about what you eat all the time. It's needing to do finger sticks to check your blood sugar. It's needing frequent follow ups with a slew of different specialists. It's the risk of diabetic retinopathy, the number one cause of blindness in adult Americans. It's the risk of diabetic nephropathy, the number one cause of end stage renal disease necessitating dialysis in adult Americans. It's the poor wound healing where you get a cut on your foot that never heals and you end up needing an amputation. diabetes is a very restrictive disease in that it requires a lot of continuous effort. And it's something like a third of Americans are diabetic or pre-diabetic. And those numbers are going up. And we're seeing more type 2 diabetes and pre-diabetes, even in children. And that's a very concerning trend. And that can have people like me actually fearing that children's life expectancies might actually be shorter than the generation before them. And that's not what humanity wants. You know, we want to keep moving in that correct direction. But if you have 8-year-olds with pre-diabetes, which is something that's seen clinically all the time now, if they're full-fledged type 2 diabetic in their 20s, this extra blood sugar helps contribute to atherosclerosis, the hardening
Mm.
of the arteries. That contributes to peripheral arterial disease, where the arteries in your legs get all gooped up and not enough blood gets to your feet. And also to coronary artery disease, where that plaque builds up, narrowing your coronary arteries, leading to heart disease. So diabetics have something like a 10 times increased relative risk of heart disease. So there's a lot of things we can do about it. And it's a disease you really don't want to have, not just for quantity of life, but for quality of life.
And I think that's important to bring up too, the end organ damage that is actually caused by this disease. So few people actually think about diabetes as something that's going to cause you to go blind, literally lose your eyes, literally lose your kidneys. And even with some of these more pediatric cases that we're now finding more and more commonly, they're even finding studies that suggest that it's having behavioral health issues in terms of ADHD, chronic depression, because of the peripheral and central nerve damage that is being done. So it does wreak absolute havoc. So it's important now more than ever to kind of recognize what we can do to modify these risk factors and really get ahead of this.
All right, so now let's jump in here. I've prepared a couple slides for you guys. I've done my homework. I was joking to Chris before. You know, I try. We really do try to put a lot of effort into the podcast. And then my son made a time lapse video of the. We recently had some snow, and he's really wanted to make a time lapse video of the snow, so he made it. And he's an aspiring YouTuber, and so we finally uploaded one of his videos on YouTube. And I was like, his video is probably going to get more effort than mine. He like put the iPad in the windowsill for 4 hours, and then I'm working on all these PowerPoints and stuff like that. And they're going to be like, oh man, I love time lapses. So, but I did prepare some slides for you guys just that we're going to work through here. So give me just a sec. All right, and now
I'm a big fan of the slideshow, by the way. I am such
I
a
try.
visual learner.
I put a little effort in
I
here.
am such a visual learner, and I'm just old school that way.
So let's talk about the actual definition of diabetes. And so, and very briefly, there are other types of diabetes. There's gestational diabetes that women get in pregnancy because the placenta starts making too much of this hormone called human placental lactogen that causes insulin resistance. That usually goes away after pregnancy, but those women are at an increased risk. About half of them will have type 2 diabetes by age 50. There's cystic fibrosis associated diabetes. There's type 3C diabetes, which is caused by pancreatic damage, that if you get pancreatitis, you can then damage the cells. That tends to be more brittle and often require insulin. So there are a lot of different types of diabetes. The majority of diabetes in America is type 2 diabetes, the vast, vast majority. And so we're going to really focus on that and what we can do about it. So pre-diabetes, also called impaired fasting glucose or impaired glucose tolerance, is defined as, so again, somebody doesn't just wake up with type 2 diabetes very abruptly. Their sugars tend to trend up over time. And that's why we're really screening people much more, hoping to catch them when they're just pre-diabetic, when their sugars are trending up. And if we start lifestyle interventions, and most physicians would add metformin here, try to really keep that blood sugar from trending further upward. And we'll put a link in. There was a study, it was a long time ago, I think it was like 2012, a study in Diabetologica, but they started to find an increased risk of heart disease once your hemoglobin A1C gets above 5.5. So these
Mm.
numbers are a little bit arbitrary. And I would actually, you know, I would want to keep my hemoglobin A1C less than 5.5. And actually, hemoglobin A1C actually predicts heart disease risk a lot better than most cholesterol. You get a pretty linear relationship relationship once you start getting above 5.5.
Interesting.
So prediabetes is defined as a hemoglobin A1C of 5.7 to 6.4, a fasting blood sugar of 100 to 125, or a 2-hour oral glucose tolerance test of 140 to 199. That's where you come in, they check your sugar, you drink a sugar drink that has 50 grams of sugar, and then they check your sugar again 1 and 2 hours later. Now let's talk about this hemoglobin A1C a little bit. So hemoglobin A1C is also called glycosylated hemoglobin. You have hemoglobin in your red blood cells. And glycation is when sugar goops onto protein. So the best analogy for hemoglobin A1C is to think of a M&M. So you know how M&Ms have a thin candy shell?
Yes.
So what they essentially do is, because your red blood cells circulate for about 2 to 3 months, as normal red blood cells circulate more like 3 months. Actually, the higher your blood sugar, the shorter your red blood cells last. So what they do is they measure how much sugar is gooped onto your red blood cell. They actually essentially measure the thickness of the sugar coating of your red blood cells, and then they can correlate that with your average blood sugar over about the last 2 to 3 months. So hemoglobin A1C can be very helpful because it gives you a picture as to how somebody's blood sugar has been doing over the last 2 to 3 months. And so that's used both for diagnosis and then for following the patient to sort of look at how well controlled their blood sugar is. And so the American Diabetes Association recommends a hemoglobin A1C less than 7 as a marker of good control. That's still high, but that's pretty good for a diabetic. Some other societies, like endocrinologists, want you actually less than 6.5. And some actually general practitioners are like, I don't really care if you're higher. And the older you get, the more lax they are, just because the tighter your blood sugar control, the higher the risk of symptomatic hypoglycemia. So if you have a patient who's 98, the risks of aiming for super tight control are thought to be outweighed by the benefits because they only have so long left anyway. So then once you meet any of these 4 criteria, where your hemoglobin A1C is above 6.5, your fasting blood sugar is above 126, your 2-hour oral glucose tolerance test is above 200, or you have any random glucose above 200 with symptoms of hyperglycemia, we usually talk about the 3 Ps. So polyuria, excess urination, polyphagia, excess hunger, because again, your blood sugar is high, but your cells are starving. So the cells don't know there's all this sugar. So they're like, food, food, for the love of God, food. And then polydipsia, excess thirst as well. So as you can see, it's not that these criteria are stupid or really flawed, but they are a little arbitrary. And it's really, when you say someone has type 2 diabetes, it's really just another way of saying that their blood sugar is too high. And if you have somebody who doesn't exercise, who eats more carbs in a week than a caveman would have in a year, and is dramatically overweight or obese, well, then we should really sort of just think of this as an inevitable manifestation of their lifestyle, more so than, oh, now you have this external disease necessitating med therapy.
Right. It seems odd. Exactly. It seems odd to categorize it as a separate disease. It's just like, no, we are having something going right here.
And again, it's sort of another overlapping risk factor here. And that's one of the big concerns with diabetes. Again, it's a very significantly increased risk of heart disease, which is the #1 killer of adult Americans. So, all right. So now, what can we do about it? Hopefully now we've explained what diabetes is. We've made clear why it's more adaptive to think of it as just your blood sugar is high, instead of, oh, there's this, now I'm suffering from this external condition that I'm powerless about. And if we say, oh, well, your blood sugar trends up over time, and now when your blood sugar gets high, you're said to have diabetes, what can we do about this? So here are a bunch of overlapping factors that really contribute to the development of hyperglycemia. So fiber deficiency. So what's interesting about fiber is it's a carbohydrate, but it's not biologically available to us. Like, we lack the capacity to break it down and derive calories from it. And the benefit of fiber is that fiber slows the absorption of carbohydrates. So if you eat a bunch of simple sugar, your bloodstream, that sugar goes into your bloodstream very quickly, and your pancreas has to very quickly churn out lots of insulin to lower your blood sugar. And you end up getting this kind of roller coaster effect, where your sugar
Hmm.
goes up, you make lots of insulin, it goes down, it goes up, it goes down. And when you're just eating nothing but carbs and you're having these rapid blood sugar fluctuations, then you're never really full. You don't get that satiety. When you just snack on these processed carbs, you're back in the pantry 15 minutes later. And that's sort of the idea of the zone diet, is to try to eat a combination of carbs, fat, and protein to keep your blood sugar stable. And fiber helps to do that because it slows the absorption of carbohydrates. And fiber also helps to speed up transit through the GI tract, which decreases your risk of colon cancer pretty substantially. And it also helps to lower cholesterol because it blocks some of the absorption of those lipids into your bloodstream as well. So, fiber, I would say, is an underused treatment for type 2 diabetes, and also an underused modality of trying to prevent diabetes, both from diet and potentially through supplementation. So, if you were to drink like 4 ounces of apple juice that has 80 calories just from sugar, that's going to make your blood sugar go up faster than if you were to eat an apple that has 80 calories, because that's also going to have 4 grams of fiber in it. And Americans only get about half the recommended amount of fiber, somewhere around like 10 to 12 grams per day, when it would be recommended to have more than that for men, even up to like 37 grams per day. So the average American is very deficient in fiber. And so adding fiber to the diet, through fruits and vegetables and beans and legumes, bears a lot of benefits, both from the fiber and from the whole food. But like we talked about with vitamin D, you'd only really want to take a supplement of something if you're accepting that because of our lifestyle, we're just very unlikely to get enough of this substance naturally. If you're living at a high latitude in the middle of winter, you're just not going to get a lot of vitamin D unless you're eating whale blubber.
Hence how
And
pasty
so,
white I am.
yeah, so but Chris's skin reveals that he,
I am
so,
taking a lot of vitamin D right now, believe me.
So fiber sort of is similar in that it's very hard to get enough through diet for the average American. And so it is, I think, worth considering for for people who have a strong family history, because there's definitely a genetic component, using fiber as a way of primary prevention for diabetes. And you would want to take that fiber with meals to essentially slow the absorption of those carbohydrates. And it would make sense, if you're just taking it once a day, to take it with the carb heaviest meal of the day, which for most people is dinner. Because we eat these carbohydrates, they get broken down into sugar, go into the blood, elevate our blood sugar, and that makes your body have to release insulin to move it into the
And
cell.
as an added benefit too, if you take it with your biggest meal of the day, you actually tend to eat less because you get a more full feeling from the fiber supplementation,
And again, when you think of, well,
which is a nice benefit.
if you're taking a fiber supplement to try to prevent diabetes, other benefits would be lower cholesterol, lower risk of colon cancer, and probably extrapolating. I think if you were to do longitudinal studies, I think you would actually find lower overall cause mortality and lower risk of heart disease. So, a lot of fibers they advertise as like 3-in-1, but it's really not just, marketing, nonsense. Like, you could take it to lower your cholesterol, you could take it to lower your blood sugar, you can take it to reduce your risk of colon cancer. And to really get drug like effects, you'd have to take it very frequently. Like, it was recommended to take it 4 times a day. But if you're taking it just for primary prevention, once or twice a day, I think would be likely to give you a lot of that benefit. And it does, if you take too much fiber at once, it can cause cramping. It takes a while for your gut to get used to it. So I would say titrate that up slowly. Don't just start, oh, I'm really motivated, let me start taking, 5
Bucket of
capsules
fiber.
4 times a day. Start with 5 capsules once a day. Or you can get capsules, or you can get a liquid that you mix in with water. So a high glycemic load diet. So let's break down this concept a little bit. So there's two different related values. There's the glycemic index and the glycemic load. So glycemic index measures how quickly a food raises your blood sugar. So they said pure sugar, we're going to give this arbitrary value of 100 so that we can relate how quickly other foods raise your blood sugar relative to how relative to pure sugar. So 100 is sugar, and then if something was 70, then that's a little bit less. If something was 30, that raises your blood sugar dramatically slower. And that can be a helpful value, that we want to try to eat lower glycemic index foods, a lot of which have fiber. So again, these are all interrelated. If you were to eat the same amount of carbohydrates in beans that have fiber and protein versus the same amount of carbohydrates in juice, the juice is going to make your blood sugar go up much faster than the beans. Now, the only sort of problem with the glycemic index is it didn't factor in how much of the food you actually eat. So, for example, watermelon, like the sugar in watermelon would make your blood sugar go up pretty quickly, but there's not a lot of sugar in a serving of watermelon. So the glycemic load then took the glycemic index and factors in how much carb is in that's a serving of that food. So it gives you a better measure of what that serving of food would actually do to your blood sugar. So for example, watermelon would have a lower glycemic load than its glycemic index, because even though the sugar within it makes your blood sugar go up quickly, there's not a lot of sugar in a serving of watermelon, which is delicious when in season anyway. So
There's this
does that make
wonderful,
sense?
yes, absolutely. There's this wonderful product at Whole Foods called watermelon water. It basically tastes like they take a whole watermelon and just blend it down into like a juice, but like with the pulp and everything. It is the most refreshing thing you can have on this hot summer's day.
I absolutely love watermelon. It's my favorite. And it seasonally too, there's pigments in watermelon that actually go into your skin
Oh,
to
no
help
kidding.
protect your skin from the UV light.
Oh, there you
So
go.
just sort of showing that nature understands, like there's a reason why these foods are seasonal. And that would be another goal. Like the more seasonal we eat, sort of the more naturally we're eating.
Nature's all
And also,
about balance.
and watermelon in the winter is cruddy anyway. I know it's like imported from far, but it's that pale stuff. I want red, like real juicy watermelon.
It's that kind
And
of like real mealy kind of taste in watermelon that's
yeah,
kind of a little bitter
it's not
and
good.
yeah, it's not good. Yeah,
It's
no.
always you buy it anyway, and then you're just disappointed. It's like the slice of pizza that's been sitting, like this
Under the
from the
hot
slice
plate.
pie, and like you eat it even though it's bad, and then you feel terrible about yourself. You're like, why am I doing this? Pizza's unique like that. That there aren't a lot of foods that you'll eat something even while you self-identify it's bad. You're not like, oh, this is bad sushi, but I'm gonna eat this, but like bad pizza, you're like, it's still pizza.
It's still pizza.
Um, and just one food that when I was looking at glycemic load, uh, the lowest value I saw was 1 for peanuts.
Oh,
That, so when you're thinking of healthy snacks, again, nuts have fat. They have only a little bit of carb. They have protein and it's healthy fats. So something like peanuts barely moves your blood sugar, but it can really improve satiety. And so that's why there is something to making trail mixes that have berries and nuts or things like that. You want to just avoid snacks that are nothing but processed carbohydrates. And so even that's sort of a criticism I have of breakfast. Like in America, breakfast has just kind of become cereal. And so, like incorporating legumes or beans or protein, like even it just adding an egg, like a scrambled egg and a bowl of cereal would actually be better than just a bowl of cereal. So there is actually something too. I always think of like Pleasantville with the 1950s mom and a ham steak, this gargantuan breakfast. But if you eat a big giant breakfast and you feel full and you only like snack for lunch and then you have a big dinner, there's really nothing wrong with that.
do
So
you remember growing up? in the cartoons, they'd have these cereal commercials and they'd say it's part of a well-balanced breakfast, and there'd be
And they'd
like
show nice,
eggs
yeah.
and bacon and like watermelon on the or a cantaloupe on the table, and like all this like stuff is like, who is eating like this?
No, yeah, and then in reality, like kids were just hoarding Cookie Crisp, like
Right.
oh, yeah. So,
I have a personal
uh,
crusade against breakfast anyway. I don't think it's a necessary meal.
unfortunately, Megan is like that. Megan doesn't wake up hungry, so on Mother's Day I can't just be like breakfast in bed,
Yeah, me neither.
so I have to like wait 4 hours, and she sleeps in anyway. I'm the morning shift, so maybe at like noon I'll be like, and here's a poached egg for you.
There you go.
Which is the extent of my cooking skill, but I can poach an egg and put it on toast
It can be
already.
tricky,
I
properly
try.
poaching an egg.
So 4 minutes exactly. Um, and so trying to aim for foods that are lower glycemic load and lower glycemic index, that will help to keep your body from growing numb to insulin, because it makes your body not necessitate such rapid spikes. Now, inactivity or sedentary lifestyle, again, carbohydrates are our fuel. And so if we are using those carbs because we're exercising, well, then we don't have to worry about it. We're going to be using it. If there's sort of equilibrium between intake and energy output, then you don't really have to worry about the body growing numb. You think of Olympic athletes that are eating 8 or 10,000 calories a day and training like beasts, all day. They don't have to worry really about getting type 2 diabetes from the carbs they're eating, because there's a balance. What's
Mm.
happened in America is, if you take a sedentary lifestyle and you take a very high processed carbohydrate diet, well, now we have this big imbalance. So we're having to store energy all the time, and that is going to brew this insulin resistance. And that's why there was a study that I thought was very clever a while back. Um, two studies that were published together. But there was a study, and it found that 150 minutes a day of moderate intensity, I'm sorry, not per day, that would be asking a lot. 150 minutes per week of moderate intensity exercise decreased your risk of type 2 diabetes about 25.1%.
Wow.
And so that's significant. So, if you can get your 2 group exercise classes in per week, our bodies adapt to demands. We have to challenge our body. That means very different things to different people. It doesn't matter what your starting point is. It matters that you're challenging your body to get better, to get stronger. That could be just walking more. That could be squatting, doing a 5x5 at the gym. That's different for different people. But demanding of your body and challenging your body and staying active, that's one of our best defense to keep our blood sugar normal. You could say it sort of two ways. It's like exercise increases insulin sensitivity, or you could just flip that and say exercise decreases insulin resistance. But when we're exercising, that makes our body want to accept that sugar because it needs it to fuel that exercise and to rebuild.
And that's
And
really what's driving this whole insulin resistance to cause type 2 diabetes. So that's really an important factor there.
we can think of it that there's just this inherent imbalance between the energy we're taking in and the energy that we're expending. And so we're having to store all this energy, and eventually that storage mechanism is wearing out. And so there was another study that I really liked that was published at the same time. And if someone gets diagnosed with type 2 diabetes, they get the same standard advice to exercise more. But I mean, we just have to go farther than that. You can't just say, oh, just go exercise, to people who don't exercise and are overweight, and now they've got a bum knee and a bad shoulder. It really does take a lot of effort to learn how to exercise and to train safely. And that's where we really do need like more multifactorial interventions, where you're getting like in-home nutrition therapy, you're getting cooking lessons, you're working out in a group with a trainer. It takes a lot of effort, unfortunately, to really learn how to exercise safely and correctly. And so, people are told the same kind of standard advice: oh, get 30 minutes of exercise per day. Well, what these researchers did is they took a group and told them to exercise for 30 minutes per day, And then they took another group and they said to exercise for 10 minutes after meals. And what they found was actually much better blood sugar control in the group who exercised 10 minutes after meals 3 times a day versus just 30 minutes all at once. And that goes back to that, that pairing exercise with your carb intake. That if we're taking in all this energy, seeking to expend it around the same time makes your body not have to store it and use all of that insulin. And so I thought that was a clever study that actually, like 10 minutes of exercise 3 times a day after meals was more helpful than just 30 minutes per day all at once.
And I would think that would be a much more attainable goal for certainly anyone starting out who maybe lives a more sedentary life, doesn't really know how to exercise. Just saying, hey, go for, a moderately brisk walk for 10 minutes after each meal. There's your half hour, and you're going to be doing yourself an incredible amount of good that would add up over time. You wouldn't even realize.
And it's something
Incredible.
that we talked about last time too. The problem sometimes with our studies is when you study drugs and you only compare them to placebo, we're forgetting about the power of lifestyle interventions. If you were, like, hypothetically, if we were to take 2 groups and we were to randomize them, and one group to exercise take a 10-minute walk after meals for the rest for 50 years, and then another group didn't, don't you think if we did a longitudinal study that you would find lower risks of heart disease, diabetes, hypertension, probably even like colon
Cancers,
cancer and
I would
stuff
have to
too?
think. Yeah,
I
absolutely.
mean, it would
Absolutely.
really just all cause mortality. That benefit of even something as simple as walking over meals. When you think of it, even if you just did it after dinner, like a 10-15 minute jaunt after dinner, and you're really committed to doing it every day for years at a time, those health benefits would be substantial. And when you start addressing a lot of these factors together, you start to get cumulative benefits. And that's kind of what we're going at here. All right. Now, this concept of constant anabolism. So, anabolism is when our body builds things. Catabolism is we take big things and break them down. Anabolism is we take small things and build them together. And so, when we have more sugar than we need, we link that together and make this big long chain called glycogen. So we store our sugar as glycogen. So if you're eating more carbohydrates than you need, those carbs become sugar, and then that sugar will get stored as glycogen or fat. That's anabolism. And I know you wanted to talk a little bit more, Chris, about what are some things we can do to try to keep our body from always going in storage mode, because you would intuitively think that as a animal, as humans, nature kind of expected us to have to forage for food or to sometimes live off our stored energy, not constantly be bringing in new energy.
Yeah, I actually did quite a bit of research into one of the biggest diet trends right now, intermittent fasting. And I was actually refreshed to find that there was quite a bit of available data and even formal research. Anyone that knows me well in my practice, I'm always a big fan of lifestyle factors first, as opposed to jumping to medicine. There's certainly a role for medicine, certainly in diabetes and type 2 diabetes. I don't want to say there's not. But anytime we can try to modify something or prevent something with a simple lifestyle altercation, that's kind of where I'm heading, where I'm trying to focus. So I was very, very pleasantly surprised to find some really great data on this intermittent fasting. So just a little bit of a background, Dan, for people that don't know, intermittent fasting is a practice basically where you're denying yourself calories for a set period of time. Now, people do this for lifestyle health benefits. People do this for cultural and religious reasons. So there's all kinds of different schedules, so to speak, and all kinds of different ways of doing this that people have come up with. Some are just more traditional and faith based, and some are actually more kind of science based. So there's probably in the literature that I came across 3 main different ways of doing this. So you have your alternative day schedule, which basically you have a 24-hour period where you eat, still in moderation. You're not eating whatever you want, but still the goal is to eat in moderation in a well-balanced diet. And then the next 24 hours, you're completely fasting, nothing but clear liquids. And then the following day eating, following day fasting, and so forth to an every other day interval. The other schedule is a 5 to 2 schedule, so to speak, where you have 5 days where you're eating a normal, well balanced diet, and then 2 days of fasting. And I've seen this done two ways where you have 5 days in a row where you're eating and then 2 days of straight fasting. Or I've seen also schedules where people will say, eat for 3 days, fast one, eat four, fast one, almost kind of like a Tuesday, Saturday fasting kind of schedule so that you're breaking it up throughout the week. And then lastly, which is by far the most popular form right now, is the, so to speak, eating window, as they call it. You have a window of time where you're allowed to eat, and then the rest of the 24 hours you're completely fasting. So most popular ways of doing this right now is you have an 8-hour period where you can eat, and you have a 12-hour period where you can eat. Um, and that's kind of what I follow as well. So the way this would work is you would say maybe like 10 a.m. to 6 p.m. You eat whatever you want, and then the rest of the time from 6 p.m. on throughout the night, all through the morning until 10 a.m. the next day, you're not eating anything. So basically, getting a full 16 hours of fasting. Some people do like a 12-hour shift where maybe 7 a.m. to 7 p.m. they're allowing themselves to eat, and then 7 p. to 7 a. they're doing completely fasting. But based on what I've seen in the research, the 8-hour window really is the most effective because basically you get the most benefits starting at 8 hours from the last time you've had something to eat. Because basically, what happens on a more physiological level is after about 8 to 12 hours of your body being denied any kind of carbohydrate, your metabolism makes this flip from where it's breaking down carbs and sugars to make energy, and now we're breaking down fatty acids to produce ketones. And ketones are a highly energy potent molecule that your body can use for energy. And that's what happens when we break down fats and proteins. So that's very important. But this process only begins after you haven't been eating for 8 to 12 hours. That's why most literature recommends that if you are going to do the eating window, that you do 8 hours as opposed to 12 hours, because basically the longer period of time you fast, the more you're going to be in this period of breaking down fats to make these ketones to get your energy from there. So you may be asking yourself, why is this important? Why wouldn't I just reduce my calories, go on a diet? And that's a good question. They've actually done studies where they've taken people into two groups. You have a intermittent fasting group, and then on the other hand, you have a group that eats completely normal except with a, say, 25% calorie reduction. Now, notably, if you're just trying to lose weight or thinking about this as kind of like a weight loss intervention, they both lost similar amounts of weight proportionately in the two groups. But the interesting thing was the intermittent fasting group, when they looked at more of their lab work and ran more diagnostics, they found that things like their insulin resistance was better. Things like their cholesterol numbers were better. Their atherosclerotic risk, which leads to a number of heart diseases and things like hypertension, were much better compared to the group that simply just reduced their calories. So visually, they may have seemed like they had a very similar outcome, but the intermittent fasting group was getting all of these benefits that the simple calorie reduction group were not getting. So it's not an equal intervention by the least. And they theorized that a lot of these things are because, like you said, Dan, when we were back in the Paleolithic age foraging for food, we were going great spans of time without eating food in between. So there are all these cellular pathways that developed around the fact that we wouldn't have instant access to nutrition that our bodies were taking advantage of to help maintain our health status. Things that we don't really even realize today because we have this big commercialized, you got to eat your 3 meals a day, breakfast most important meal of the day kind of thing, that we're not really realizing these benefits until we really start to look at it.
And
So
so the logic behind it is that like there's benefits to firing up these catabolic processes,
yes,
and ketones are a marker of fat catabolism, so it shows
yes.
that your body has started to burn down, and that even if the exact mechanisms aren't known, but just every once in a while it makes sense to kind of fire up those engines in demand of your body to run off stored fuel versus just constantly putting in more energy.
Right. So exactly. So in addition to just breaking down those fat stores, and reducing your calories and weight reduction, it seems like there are all these cellular pathways that your body responds to these fatty acids that it's breaking down in regards to these ketones to actually optimize all kinds of things like your cardiovascular function, your immune function, and we're really just starting to understand these things. So it's actually a very exciting intervention that I'm looking forward to really kind of keeping up on and paying attention to more studies, more longitudinal studies to see what other health outcomes we can kind of curtail by this simple intervention. Now,
And
I'm sorry, go ahead.
I just had a question for you. Is one of the ideas of like restricting the food, you said like after 8 p.m., just because if you're eating before bed, you end up not burning any of that, like you just end up storing it and
Well, yeah, it was actually funny because there's a lot of kind of contradictory advice about when you should have your eating window. I personally choose the 12 noon to 8 p.m. Eating window just because, as we discussed, I'm not the type of person that wakes up hungry in the morning. I actually, most days, don't eat any kind of formal breakfast. For whatever reason, my stomach is asleep for many hours until I start moving around. I start getting some activity in me, start drinking some water. So I may not get hungry naturally, organically until about 11 o'clock or noontime. So that works perfectly for me. What they actually suggest, though, in the research is that you do a 7 a.m. to 3 p.m. window because, as you discussed, the farther away you can get your calorie consumption to the point of time you go to bed, you're going to get the most benefit out of it because you want to spend the most hours in your fasting period during the waking hours when your metabolism is most active and being driven the most, because when you go to sleep things slow down, your metabolism slows down. It's going to take a lot longer for those pathways to open up. So if you stop at 3 p.m. and you have a full 8 hours before you even go to sleep, you're already in that ketone process. So you're making the most of it. That personally wouldn't work for me. I know if I stop eating at 3 p.m., I would be absolutely tortured. I would not be able to make it. So 8 p.m. works for me because, exactly like you said, that gives me a solid 2 to 3 hours before I'm going to sleep, letting everything digest and really kind of start getting into that mode before I go to sleep. So that way I am at least starting down that track, and then I wake up usually, 7, 8 a.m. in the morning. And then I have another solid 6 hours of fasting during my waking hours, really to get the most benefit. But yeah, ideally you would do it having your eating window as early as possible, just to get the most of those benefits. It just doesn't work out for me. You can only do so much.
I remember a long time ago, I had a friend who was trying to gain weight and asked for advice, like how to gain weight. And I was like, oh, it's really easy. Just eat Pop
Eat
Tarts
before
before
bed.
bed.
Yeah, eat eat
You know,
eat high
like, oh,
density
just
food
eat a
before
bunch
bed.
of like
Yep.
processed carbs right before bed. You'll just store it and,
Ben
like
and Jerry, he's your best friend before bed. Like,
yeah.
like if you're trying to gain weight, if you're a bodybuilder or something like that. Right, exactly. That's an interesting point. You can actually take advantage of that in the opposite way if you're trying to bodybuild or anabolize. So yeah, it works that way too.
And then I know we struggle to stay on track sometimes,
Yeah.
but they are sort of looking at ketosis as being adaptive for all sorts of stuff, besides like even fertility treatments. Or I mean, there's a lot of research going into it, seemingly
There
now.
seems to be a lot more physiological functions to it than we initially realized, which is exciting because this could be one of the a new lifestyle modification that can have so many health benefits that we're only just learning about. So it'd be really great to learn how to optimize it. And then as a more balanced approach to the eating window, some people like to do 10 to 6 that way. 10 o'clock, you're still having some semblance of a breakfast. You can eat a lunch and a dinner if you're a 3 meals kind of day kind of person. There's still room for that. Um,
And this is also sort of like the same kind of process people are trying to exploit with a ketogenic diet.
yes, exactly. Although I would be interested to look a little bit more into the whole keto diet and the research around it, because when I talk to people that are part of what I like to call the cult of keto, they try to describe to me what the physiological process that's happening behind that diet, what it actually is. And me, as somebody who's actually very adept at anatomy and physiology, it doesn't really make sense to me. And I want to say to these people, what you think is happening is not really what's happening. So I'd actually be interested to do a little bit more research into it myself.
Like, my understanding is it's really just like, typically less than 50 grams of carbs per day. Some super hardcore people, it's like even less than 20. And again, it's 4 calories per gram of carbohydrate. So we're talking like less than, really extreme cases, less than 80 calories per day from carbohydrates. And
Right.
just the idea is, by eating a virtually no carbohydrate diet, you're then forcing the body to start burning fat for energy. And when you start burning fat for energy, you produce the ketones. So you're sort of depriving your body of carbs to make your body burn fat. And so the keto diet definitely does work for a while. You lose a lot of
But
water weight very quickly, but and there's some logic to it, but it does seem very extreme and very restrictive and hard to maintain for a very prolonged period of time. But there's some truth in there that even what the average American would consider a low calorie diet is still a pretty high carbohydrate diet if
well,
we're sort of comparing to paleo times or things like that.
yeah, and I guess the reason I would want to look into it more is because my understanding of how the digestive tract works is as long as there's something in there, your body's going to release insulin, whether it's low carb, it could be, the highest protein you could possibly find. As long as your body is digesting something through your GI tract, it's going to find carbs there. It's going to find carbs in that protein. It's actually going to, through metabolic processes, break down some of that protein into just straight carbs. It can do that. It's not as much of an efficient process, but it can and will do that. And based on my understanding of the physiology, the only way to break down your fat stores into ketones is to deprive yourself of any kind of nutrition, is to go into that state of starvation. That's where our body breaks down ketones. That's why you go into diabetic ketoacidosis, is because your body thinks it's starving, even though you're eating and eating. That insulin resistance is thinking that it's starving. That's why you produce all those ketones. So to me, even if it's an extremely low carb diet, really you're just kind of rebranding Atkins as far as I can tell. So that's why I'd really like to dive into it a little bit more, because I'm sure there's more eloquent explanations than these like random people that read about it in an article and say, "Oh, I'm going to do keto." I'm sure there's like more academic research into it that I'd like to dive into.
But yeah, but the general idea of a ketogenic diet is to dramatically restrict carbs and
Yeah,
thus force your body to burn fat producing ketones.
but
And
I don't think
there
that's
is
what actually happens.
yeah. And there is a difference between ketosis and ketoacidosis. So, majoritatively, type 1 diabetics, because they make no insulin, if they don't take their insulin, then they completely aren't getting any sugar moving into the cells. And they can actually burn so much fat that toxic levels of ketones build up.
Right,
And
right.
ketones are acidic, so that actually lowers the blood pH. That's called ketoacidosis. You can see that when their blood sugar gets like up over 250 or 300. Whereas in a healthy person, even if you deprived the body of carbohydrates, your body has mechanisms that are pretty good at regulating your blood sugar. So you really wouldn't expect someone's blood sugar to go very low, and their body would just start burning fat for energy, producing some ketones, ketosis, but
Yeah.
not enough to actually affect the blood pH.
I don't, yeah, because I don't know that your blood sugar would ever go low enough to actually make that metabolic switch. Not at least to the efficacy we see with something like intermittent fasting, because you're literally just going long stretches of time without getting any kind of calorie there. But like I said, I'd be interested to look into it a little more.
And again, your body, it's what's called a negative feedback loop. It's like your body
Right,
wants to keep your blood sugar in a certain range, so it has mechanisms to lower the sugar. If your sugar gets high, the beta cells of the pancreas release insulin, and if your blood sugar gets low, the alpha cells of the pancreas release the opposing hormone glucagon to help keep the blood sugar normal.
right.
So, but I do think there's something there of the idea that, like we're sort of frying our body's capacity to accommodate all their carbs we're eating, because our body wasn't meant to just be constantly in that anabolic storage mode,
Yeah.
and was meant to be running off of our stored fuel every once in a
Yeah,
while.
but I think at the end of the day, in conclusion, I don't want to crap on the keto people too much. I think it actually
It's too
is.
late for that. You're gonna.
I think
hide your Twitter. You're gonna,
I'm gonna get doxxed. No, I think at the end of the day, it is, inadvertently a very healthy, reasonable, manageable uh, dietary
well,
intervention.
if you get rid of all these bread-based foods,
Yeah, which is why I just
you're
call it Atkins rebranded.
yeah. But I mean, there is something there that, if you are then eating healthy fats, even and meats, but you're really getting rid of just a lot of these processed carbohydrates, aiming for that extreme carb reduction, you'll definitely see some health
You'll definitely
benefits
see some
within that
benefits
weight
either
loss.
way.
But it's hard to maintain forever. Eventually you're gonna start wanting to
Well,
stop.
yeah, I mean, all diet modifications that aren't ultimately lifelong lifestyle modifications do fail for that reason because
I
you can't.
completely agree with you. I
Yeah,
loathe the idea of dieting in general. And one thing, we're going to focus more on preventing diabetes, but I hate when diabetics use the word cheat. My mother was like that. My mother would be
yeah,
like, "Oh, I cheated on my diabetes," because she would eat a bunch of crap. And I was like, "Well, it's not really cheating. Like non-diabetics eat stuff that's not particularly healthy too. You just need to know what is the corrective dose of insulin." And she never like got that and never learned that. Like, and I'd say to some degree that's a weakness of diabetes education. Like
mhm,
people, diabetics who progress to the point where they're on insulin need to know, like, all right, if you are going to go to town, like if you are going to go for the, Reese's Sunday at Friendly's because it's your birthday and you only live once, like how much extra insulin should you take? And that's something that she just kind of never got.
yeah,
And so she was only giving herself insulin based on her pre-meal sugars, but then wasn't really factoring in that she wasn't eating the diet, and then never really got good control of her sugar. And it was challenging being a son. She'd be like, "You're my son, not my doctor." And after a while I had to be like, "Yeah, you're right, you're a grown up,
yeah,
you have the,
yeah.
but she was sort of also living in this world where she was eating a coffee roll for breakfast every morning, and in her mind was compliant with her diabetic diet. So
Yeah, it can be awkward being a
yeah,
healthcare clinician and then having to deal with your family and just
it's
kind of constantly face bombing.
even when you really are acting of beneficence, like you really are
Hmm.
trying to help. People have the right to be like, "Shut up, I don't want to listen to you talk about this. You're my son. I changed your diapers." And have to be like, "Okay, you're right, Ma. You're a grown person, you have the right to make your own decision." All right. And try not to, then be glib or when negative consequences happen because of that. All right. And then related to that, number 5 here is our processed carbohydrates. Like we've said a couple times, because all these things are overlapping. All these bread-based products. It's just so many carbs. When you think of how many carbs are in a whole bagel, or if you get a short stack of pancakes, you can kind of make an argument that it's almost like an unnatural amount of carbohydrates. I mean, soda, for the love of goodness. I mean, it's just so much concentrated sugar at once that it's challenging your body to accommodate all these carbs, especially over time, and especially with just my kids eat an American diet. We eat an Americanized diet, but one thing that I felt strongly about, that I had to like fight with the grandparents and the aunts and uncles who are always looking to subvert your will and like give your kids crap to eat. Like I really do feel strongly about avoiding snacks that are just
Mm.
processed carbs. Like when my kids want to snack, you can have strawberries, you can have apples, you can have a banana, you can have yogurt, yeah, applesauce pouches, even that's fine by me. But I just want to avoid that uh, growing up, getting used to just eating like the goldfish, like just eating things that are nothing but processed carbohydrates, like
Yep.
crackers and peanut butter. Okay, or crackers and cheese, just crackers, just goldfish. Again, when you're just eating those processed carbs, your sugar goes up, you make a lot of insulin, your sugar goes down, and you're roller coastering. And that's why you want a second bowl 15 minutes later. You're never really going to get satiety, and it's just a bad habit. And those are really, foods with very minimal nutrition. And especially when you think, if you could substitute something actually healthy, if you could substitute a fruit, then there's really a double negative, because you're missing out on something positive, and you're really kind of adding something that's not very nutritious. And then soda and juice consumption, because again, when we're drinking our calories, that sugar is much functionally higher glycemic load. That's why if someone's blood sugar is low and they're conscious and can swallow, what's the first line treatment? Like 4 ounces of juice or
Yes.
5 to 6 ounces of soda. And a lot of people, there's a misconception that juice is very healthy. A lot of juice actually has more sugar per serving than soda. And
Yes.
so you'd much rather eat the fruit than drink the juice. Now, if somebody was actually juicing and taking fresh produce, and almost like, instead of a multivitamin, taking this juice blend every morning or something like that, that kind of makes some sense to me. But you'd really be better off getting your kids, and for yourself, getting in the habit of drinking water than drinking juice, because it really is a lot of calories just from sugar.
And if I can just save everyone a lot of trouble, a quick little public service announcement about buying one of those tabletop juicers. Do not waste your time or your money. They are
A lot of money.
so incredibly difficult to clean. You will not want to do this every day. Unless you are an absolute juice freak, do not bother. Pay the 15 whatever dollars it is for the jug of Odwalla. Do not juice your own fruit. It is such a pain in the ass.
You end up with like a $400 thing sitting
A
underneath the
$400
kitchen
thing
cabinet.
collecting dust on the shelf. And yes, I am a huge, huge crusader when it comes to getting rid of drinking your calories. So not just the juices and the sugary sodas, but the coffees. Drink black coffee, people. These
Giganto
gigantic
coffee.
coffees with all these freaking whipped whatevers and, caramel flavor colors. God, especially here in New England, people and their coffee, for Christ's sake. Just drink it black if you absolutely must drink it. That's a little splash of cream just to take out the bitterness, but stop overloading all this stuff.
Or yeah, I mean, a sugar, but I forget now, but some of those, like, Starbucks creations
Oh
and
my
things like
God.
that. I think we were getting like north of 1,000 calories
Oh
for some
yeah,
of them at the
easily.
larger sizes.
Easily.
Like, that's a lot. All right.
A lot.
And now, just to sort of highlight, and sort of show you how some of these things can play out here. So
That was my favorite part.
I took some nutrition info from the McDonald's website. And let's actually, I'm not one of those people who tries to blame McDonald's for obesity in America, or really vilify fast food in general. I think there's a misconception that, sit down restaurants must be healthier than fast food restaurants. But the portion sizes are so nuts at a lot of sit down restaurants
Yeah,
that
at
that's
least
really
double.
not the case. I mean, even you go somewhere and you get a salad, but you use blue cheese dressing and you got fried chicken in it,
Yep.
which sounds really delicious. But I mean, you're talking a lot of calories. I do think fast food has been a little bit unfairly vilified. And at least they're very transparent now, after like unsuccessful litigation, but litigation nonetheless, about the nutrition content.
Right,
And
right.
it seems like
Thank you,
they're
Supersize Me.
trying. So, uh, but
Can't get the supersized fry anywhere anymore.
just to sort of, and those portions were insane, and it did make a good point, or even you think of like the soda sizes now, like at the movies, like there was a time like 10 years ago where you could get like an ultra or something, just like
You don't like
a
the double big gulp there,
gigantic soda.
Dan?
You had to use two hands to carry this thing,
Like a literal bucket of soda.
and or I remember even going to like Cumberland Farms as a kid, and there was like you got a pound of soda.
Oh my God.
They were measuring it in terms of a pound. And back then, of course, it was just like, oh, it's just empty calories. All the way back, I think it was in the 50s or 60s, like it's documented now that the sugar industry paid researchers to try to steer people away from
Wow.
sugar as a cause of heart disease. Like America kind of went the way of blaming fat, and other places, some places in Europe, went to blaming sugar, but they actually were like paying off researchers to write stuff like, oh, sugar, it's bad for your teeth and it's empty calories, but avoiding, the organ damage and the diabetes.
Yeah, the EU is so progressive on sugar. You can't get any of that high sugar stuff anywhere in there. Like, there's no corn syrup or any of those like
Well,
high glycemic additives.
and again, like, why is there high fructose corn syrup and everything? Because there's a very powerful corn lobby, and there's all sorts of
Oh,
subsidies to grow corn.
politics.
And then, the USDA doesn't want to get involved in it. They make it generally, what is it, like grass, like generally regarded as safe, because we export all that. America, we don't export a lot of stuff anymore, but we
Hmm.
export high fructose corn syrup and fast food and obesity, like as other
Lovely.
parts of the world get more westernized.
Lovely, lovely,
I,
lovely.
I remember I had a client, this is many years ago now. She was a very inspiring woman, one of my tutoring clients. She was from Ethiopia, and she was living in Cambridge with like roommates in the literal sense, like not even like didn't have her own room. She was living with like in a 2-bedroom apartment with 3 other people, working as a home health aide. And she was religious and had strong faith. So she tithed 10% of her income to her church because she really felt like that was the right thing to do, and that she saw how God was blessing her all the time, and that was the right thing to do. And she was sending money back home to her family in Ethiopia. And I was ultimately able to help her pass the NCLEX, and she became a registered nurse, which was very satisfying. And I mean, she was taking the T to come meet with me. She was taking public transit, and sometimes she was my last client of the day, so I would drive her to the T stop and stuff like that. And then when we were talking about type 2 diabetes, I remember she was like, "What is that? We don't have that in my country." She was from somewhere where you're like walking,
Yeah,
carrying water daily. I was like, "Yes, I'm sure type 2 diabetes isn't a big problem in Ethiopia." Like, so it's not
there's like one guy in
exclusively a
Ethiopia with
lifestyle
diabetes.
disease, but it is largely a lifestyle disease. So this is just trying to highlight, how quickly things can go awry here. So if you go to McDonald's and you get a cheeseburger, well, that's not so bad, really. I mean, yes, the burger's fried. I'm gonna get dinged by some vegan is gonna send me a message like, I'm not saying, oh, cheeseburger is the healthiest thing in the world, but if you were like, I'm hungry and I want
Strictly
something to eat,
nutritionally.
I mean, there's a mix of carbs, fat, and protein. In diabetes, you typically define a carb serving as 15 grams of carbs. So 32, that's, not crazy. It's 2 carb servings, and there is some fat and some protein with it. And so that's really not in and of itself inherently unreasonable. Now we add a small fry. We take potatoes, which have a very high glycemic load. Potatoes kind of famously make your sugar spike. Then you fry them. Well, oh my gosh, look at this difference here. We've almost doubled the number of carbs. We've added a bunch of fat, and we really haven't added any nutritional value. Now, of course, let's add a Coke. And of course, McDonald's right now, all of the sodas are $1. So, what percent of the population besides me might actually buy a small Coke? I will confess that one of my vices is soda.
Really?
I limit myself to 1 serving per day these days, but I absolutely love soda. And actually, it's November. There's a push of no soda November, just to try to highlight how much sugar really is in soda. And
Have you
we
ever
can
tried
see that here.
substituting something like seltzer or anything like that?
I hate it. I hate seltzer. My
No?
kids love
Oh, I
seltzer. They
love it.
call it bubble water.
I like
Um,
it. A little bit of
no,
lemon in there. It's perfect.
I loathe it, and I like water, and I drink a lot of water. But I do like I've limited myself to once a day, and I actually started buying, even though it doesn't make sense financially. I'm thinking like, well, what about my body? I've started buying the like tiny cans,
Oh, yeah,
you know,
yeah,
the
yeah.
the
We have
little
those at the
cans,
clinic. They're like the
and
half serving cans.
I feel
Yeah,
like I'm
yeah.
I'm being served by a steward, or like a stewardess on a flight or something.
And you're paying more for the packaging than you are the liquid.
But and actually, the most expensive part of that is the top of the can. Like it costs Coca-Cola bottling more to make the top of the can than it does the soda and stuff like
Wow.
that. So, but like to give me my fix if I'm
Yeah,
going to
right.
work. But as I am
Your
trying to limit
fix.
my portion size. Because as you can see here, like, what's the difference? Well, we've legit just added like 39 grams of sugar. A teaspoon is 4.2 grams. So, and a tablespoon is 3
Wow.
teaspoons. So, I mean, we're talking a heck of a lot of nothing but very of sugar that's
Just
in a liquid
straight
form
liquid
that's
sugar.
going to make your blood sugar go up very, very quickly.
Wow.
Now, of
Look, you haven't
course,
added anything nutritionally other than sugar.
literally nothing but
Wow.
sugar. All right. And then now COVID has closed our self-serve sodas. But if you do ever get a soda, of course you refill it going out the door because you're like, well, I paid for that, and I better get. I see my dad from my childhood. Like he would think you were being wasteful if you didn't fill up your soda. He was
They
like, I
don't
paid
call it
for
the
that.
value
You
menu for nothing.
you fill that up and you drink that for the rest of the day. And now, so you double up on essentially two small sodas. Well, now things are starting to get out of line. Now we're talking what? Almost 10 teaspoons of sugar, or 10 teaspoons of carbs, 140 grams of carbs. So what? 85. So we're talking what, like 8 teaspoons of sugar here.
And
And then
and nearly
if you
half your allotment of daily calories. My God.
if you were to just get a meal like a Big Mac, a large fry, a Big Mac, a large fry, and a large Coke. Now we're talking 1,330
Wow.
calories. That's a heck of a lot of calories, a
Wow.
lot of fat, still some protein, a awful lot of carbohydrates, a tremendous amount of sugar. Now things are getting out of line. So if you are going to eat fast food, try to stick to like just the burger. If you get rid of the fries and you get rid of the soda, that starts to not be unreasonable. I really love Five Guys. Five Guys, you walk in the door and it's just this, wonderful odor. It's like it's drawing me into their world. I'm like happy just from the smell. And then I get like a little cheeseburger, which is still big, but they call it a little cheeseburger. And I get lettuce, tomatoes, pickles, mustard, ketchup, and light raw onion. So I do try to throw some stuff on there.
Mm.
And then back when they would serve the peanuts with it, if it was like just a burger, a bunch of peanuts, and water, that's not an out of line lunch at all. And so there's really nothing like it's funny, but if you were to have the burger, the fry, and the soda, the burger's really the least of your worries. It's the fry and the soda that are actually worse. And so you can see how portion control starts to get challenging. Megan had gestational diabetes with both of our children. And so when she first got diagnosed, it was going to be like a week until she could get in with nutrition and the certified
Mm.
diabetic educator. And thankfully, I said, oh, I know a good amount about diabetes. I can help you. And I put her on a diet that was very similar to what she subsequently was placed on. But I went and looked up all the nutrition info from different restaurants because she was still working to say, like, here's what you could get. Like she could get the chili from Wendy's, because that really didn't have a ton of carbs and it had lots of fat and protein. And so that wasn't really going to affect her sugar dramatically. She could get 2 tacos from Taco Bell, but like a single slice from Papagino's, and that was like cutting it close.
Yeah,
That was like
right.
45 grams. Like, all right, you're up at your max here. But she asked me, she was like, oh, what about the rattlesnake pasta from Uno's? I really like it. And I was like,
The
oh, well,
what?
let me check. And it was like 133, grams of carbs per serving. And I was like, you can't even look at that pasta.
Only
Like
if
you
there's
need to
actual
like
rattlesnake
you
in it.
need to run out of the room if that pasta shows up. And to her credit, she was so good about the diet that none of the children's blood sugars ended up going low enough that they needed to get an IV of D10W of IV sugar in the special care nursery because she was so good about following that diet. So all of Megan's push presents were food. Like because again, it usually goes away very abruptly once the baby comes out. So I was just like, it wasn't like, oh, here's a diamond necklace or something like that. It was more like, here's your Five Guys and your sushi and all the foods that she couldn't eat
Nice.
while she was pregnant.
Nice.
She's easy to please like that. I like
I'm very
I
food
remember.
motivated myself.
Well, a couple like weeks ago, I think I had been kind of like snappish or annoying in some way, and I wanted to apologize, and so I like apologized, and then I told her I was like, I'm sure I'm challenging sometimes and can be hard to live with, but I'll never be perfect, but I'll always make it up with compensatory fried chicken, and she's like, that's you know the way to my heart, so I think Popeyes got me out of some trouble or something.
Nice.
All right. So now this is kind of going to be an overlap of some of the stuff we talked about, but some ways to prevent hyperglycemia. So, what can we actually do about it? Taking everything we've talked about so far, and let's come up with some real tangible interventions. So, aim for 150 minutes a week of moderate intensity exercise, and you really want to challenge your body. And they found like even greater nonlinear benefits above that. So, it's not that there's anything magical. Feel free to go
Mm.
above it, but at least 2 to 3 times a week you want to really try to challenge your body. And so then the challenge becomes, cognitively I know this, how can I actually implement it? And that's why I've been finding group exercise classes very helpful. I personally, I wear a mask the whole time, but I've been going to boot camp twice a week, and I've been seeing measurable gains, both in terms of my uh, like aesthetically, like my arms are getting a little bit bigger, and functional improvements in my push-ups and stuff like that, and my squats. I'm squatting 150 now.
Dan's
um,
just trying to look better naked.
that's the main, isn't, what's wrong with that is a goal, if you're 36. That's a perfectly fine motivator. That's how I try to convince men to try yoga. Yoga, because it's all just body weight, you'll look better naked in like 4 weeks, and you won't lose any weight, just your shoulders will be where they're supposed to be. Your head might be more where it's supposed to be. It'll help fix those postural problems.
And if
So,
you're not into yoga like me, something that's also worth checking out is Tai Chi. Very similar in terms of stretching and forms.
and Tai Chi is
Little
great
less
for
on the floor though.
And Tai Chi is great for older people to prevent falls.
Oh
There's
yes, good
actually
call.
really, really credible data that Tai Chi helps people with balance and helps to prevent falls. And that's a great thing. And that's something, and again, body weight stuff is stuff you can really do throughout your lifespan. So and again, you really want to demand of your body. Exercise increases insulin sensitivity, and so if you can put on some lean muscle, so your basic baseline metabolic rate goes up, that you're needing to use more energy to maintain your muscle all the time, then less of that ends up having to be stored. Walking after meals, again, if you really committed to taking a walk every day after dinner, you'd probably be happier, and you'd probably live longer.
I
All
think
right.
if you were to do that alone too, you'd be surprised at what benefits you would get from just that alone.
Consider a fiber supplement and take it with the highest meal of the day, which for most people is supper. And again, if you are going to take fiber, you don't want to take it at the same time as other medications, because it can slow the absorption of those medications. But if you're just taking
Excellent
it
point.
to try to prevent, for primary prevention, not a bad idea for Americans in general, I would assert. And certainly, if you're like me and you have a family history of diabetes, you have a family history of colon cancer, or you have genetically high cholesterol, like I do, I've been taking fiber really to get all three of those benefits. And so I try to take my fiber supplement at least once or twice a day. And then once you start taking it, again, you can have some GI side effects like cramping when you first start taking it. And then once you start taking it, try to take it steadily, because if you take it and stop and start, or you're playing around with it a lot, that's when I think you get more of the GI side
Do
effects.
you find, as someone that takes a fiber supplement, do you find that you need to stay overhydrated to avoid things like constipation?
No, I don't at all. So when you take fiber, you're supposed to take it with at least 8 ounces of water.
Mm.
And so again, if it motivates you to drink more water, that's not such a bad thing for most people either. And then also, if you take it like right before you eat supper, does that increase your satiety so that you're not, as hungry or
I would
eating
think
as
it
much
does, yeah.
anyway? But yeah, like you can take fiber in a powder, and then you can mix it with water, or you can, I always think of like my grandfather with like his orange Metamucil, And now they have
Mm.
clear stuff, and there's different types. But I just take psyllium fiber. There's different types of fiber.
Yeah, I've even
Um,
seen like clear flavorless supplements that they say you
yeah,
can mix into like pasta sauce or
yeah.
like, you know,
Like
whatever.
there's the Benefiber is a trade name,
Yeah.
but it's supposed to be
So it
like
doesn't have to
clear.
be like this gross thing.
And I personally take the capsules, but it is cumbersome in the sense that it's like 5 capsules per serving.
Oh,
And
wow.
so, the idea, I wouldn't want to have to take 20 capsules a day to get drug like effects, from it. But I would also, I think fiber is sort of an underused treatment modality for secondary prevention, for treating diabetes as well. It does get tricky because then it does slow the absorption of carbs. So you have to factor that in along with other medicines. But that's something that I definitely think is kind of underutilized. And so when you take fiber, you just want to take it with water. You're either mixing it in with water or you're taking the capsules with at least a full glass of water. And then fiber does help to keep you regular, which is sort of an added benefit. And so there are lots of people who might kind of live with like subclinical constipation, where
Mm.
they don't think of themselves as constipated. It's like normal for them to poop a little, and then 15 minutes later they have to poop some more, and like smaller. And then they might sort of be pleasantly surprised when they start taking fiber, and they're like, oh my God, it took me 20 minutes less to poop than normal. Like they'll have to come up with a new excuse for hiding in the bathroom on their phone, hiding from their children, because it's just not believable that it would be taking them that long to poop anymore. So eat a mix of carbs, fat, and protein together. Again, that's the idea of the zone diet, that if you
Mm.
eat carbs with fat and protein, you're functionally decreasing the glycemic load of that food. And then also you're going to stabilize your blood sugar, so it makes you full more, and you're avoiding, and it'll decrease your hunger. So, something like, an apple is a fine snack. If you're going to eat stuff that is just processed carbs, just do it stuff that's natural. But an apple and peanut butter, or grapes and cheese, something like that, that's a mix of carbs, fat, and protein, that's going to keep you full longer, and help stabilize your blood sugar. So whole grains are better than enriched grains, because enriched is really just like a clever word for processed. But substituting vegetables for grains is even better. And there are studies where they found that like dramatic calorie restriction and dramatic carb restriction, where a lot of type 2 diabetics, if you were to put them on like a 600 to 800 liquid calorie per day diet, you can help to normalize their blood sugars, and for about a third of them kind of reset their insulin sensitivity, so that even when you subsequently start upping the carb and calorie intake, they're still able to maintain normal blood sugars off of medications. So like that kind of diet, it would be very restrictive, but it is worth people with diabetes knowing that even though it would be a very restrictive diet, for some people who really are highly motivated and are like, I just don't want to ever have to take this insulin again, that is a potential treatment algorithm. And if they were to just get rid of like bread-based products, they'd have and substitute, vegetables being the base of their meals versus a pasta or a bread-based product, that would make a real significant difference.
And of course, pairing that with more exercise would then increase your ability to take in more
Okay,
calories
all
effectively.
these things
It
are
all
overlapping.
ties together, yeah.
And avoiding snacks that are nothing but processed carbs, dramatically reducing intake of soda and juice, eat the fruit instead, reduce intake of processed carbs, and be cognizant of portion sizes. So if we accept that the way we live, that this American way of life is diabetesogenic, that just,
Mm.
it's kind of coming for all of us if we just go with the flow, that really at any age, we should start being cognizant of things that are just processed carbs. And, it seems silly, but when you look at some of these portion sizes, especially for baked goods, like a muffin at the grocery store might be super gigantic versus what you would make if you made it yourself in a, baking pan. A half a bagel has half as many carbs and calories as a bagel. A pancake has a third as many carbs and calories as a short stack of three pancakes. So, y- with nutrition in general, you have to find a balance. It's not something to fixate on. We only live once. I'd hate to eat a vegan diet and then get hit by a car and have my last thought be like, I should have had more Snickers. Everybody is motivated to different degrees, but things that are just processed carbohydrates, seek to temper your intake of those.
Every
And then
time every time you look at a bagel, I want you to think of 5 slices of bread because every bagel is equivalent to 5 slices of bread. Can you imagine just sitting there and eating slice after slice of 5 slices of bread? That's ridiculous.
my grandfather would have, but my grandfather, my paternal grandfather, who I called Grandpa, who was just a great gem of a guy, but he grew up in that. Uh, his father actually left his family, and he was the oldest of nine children, so he started supporting the family like at age 13. He was a very admirable guy, fought in World War II for our country. I was thinking of him recently on Veterans Day, and never talked about his service because I would assume it was yucky, like, being on the ground in Europe,
Mm.
and then worked for the town of Brookline, in Parks and Recreation, and raised his four children and was a great provider and a great man. So I miss my grandfather. Well, I didn't find out until like years later that allegedly he was cheap. And I was like, what are you talking about? Grandpa wasn't cheap. He would buy you whatever you want. And everybody had to be like, no, he would buy you, his only grandson, whatever you wanted. Like, that was unique to you. Like that. So years later, I was like, Grandpa was cheap. No, just if you wanted Legos or ice cream, he'd get you whatever you want. So, um, but he grew up like, white bread and butter had to be
Oh.
served at every single meal.
Ugh.
So, no matter like Thanksgiving dinner, there was still sunbeam and sunbeam bread and butter on the table for every meal. So, and he could just eat bread and mayo too. So,
Oof.
um, and then consider experimenting with intermittent fasting. That I do think there probably is something there, that there's a benefit to sometimes firing up our body's catabolic processes. And again, the thing I would hope you take away from this is all these things are tied together. And that if we're really thinking, well, what can we do to try to prevent this disease that's affecting like a third of all Americans, whose rates continue to increase, this disease that's now showing up in very young children, and it just seems like the way we live is brewing this. Well, 150 minutes a week of modern intensity exercise, resistance training, putting on some muscle, walking after meals, and trying to pair your exercise with meals, even just push ups to failure, 50 body weight squats, a kettlebell or dumbbell swing for 2 minutes before you eat. There's some studies showing that when you do like just a little burst of exercise right before you eat, it helps to blunt that the food's effect on your blood sugar.
Mm.
And then if you're going to do like a full set, like a real, heavy 5x5 at the gym or something like that, that's usually best done a little bit after meals. But, if you exercise after meals, that does also help to blunt how high your blood sugar goes. And just doing little bursts of exercise right before also works. So either one helps, and a combination of both. But even something as simple as push-ups to failure, just kind of doing 2 minutes of exercise right before you eat to get your body in a mode of saying, oh, here comes energy. Well, that's fine. I need this. I need this because I'm exercising. Helps to make your body not have to store it. And again, the argument that we're kind of making is the reason why so many Americans have a high blood sugar is just that their body's ability to accommodate all the carbs they're eating has worn out over time.
And once you can kind of really get your head around that, I think you're well on your way to using some of these tools, if not just one, but multiple of these tools to kind of get around the problem. And it's great that there are a number of different types of tools. If you're not the most active or athletic person, or you have some mobility issues or some disability, certainly then maybe that's not the route for you. You can take extreme diet modification, core calorie reduction, or experiment with these intermittent fastings. Or, if you are physically able, do a little bit of everything. And of course, as with anything, there is a component for medication as well as needed, but judiciously, just like anything else.
And again, if we start adding these things together, if somebody were to start walking for 10 minutes after dinner every night, if somebody were to start going to 2 75-minute exercise classes per week, and then somebody was to start taking a fiber supplement every day before dinner, I think those three things combined would actually have a very dramatic effect at preventing diabetes over the long run.
Absolutely. Absolutely. So, listen, I want to thank everyone for taking the time to listen to us ranting, going on our crazy tangents, and hopefully enjoying it a little bit. We would appreciate very much if you would like, comment, and subscribe, or subscribe to our feed for the audio version as well. We'll be having all the links in the descriptions, and we'll be providing some reference material as well for some of the articles and research documents that we brought up. So, hey, it's been great, guys.
Yeah, no, this was fun. And one thing I tried to do, I tried to keep my eyes open this one. I looked back at the vitamin D podcast and I discovered that I close my eyes when I'm trying to be articulate. So I was cognizant of trying to keep my eyes open
I
here.
actually didn't happen to notice that. I'll have to look back.
Yeah, no, like and I could see in my head the wheels turning. It was like I tilt my head, and so apparently when I'm trying to think, I make odd faces. So, and thankfully my tutoring clients have never told that to me before. Zoom can make you self-conscious. It's like you're seeing a lot of yourself. You're like, this is what I look like to the outside
Hey,
world.
just let the content do the talking, all right? We
All
don't
right.
need to be the prettiest people on the block. We just need to be the smartest and most thorough, all right? Well, listen, it was a lot of fun. Thank you for hanging out with us. I think next time we're going to look into hypertension, right? And talk about the two
Yeah.
largest risk
So
factors.
we're going to try to take 80/20 approach and say, well, what are the two actual biggest risk factors for all cause mortality? And then what can we do about it? So, again, focusing on your health should be a part of your life. It shouldn't be the focus of your life. And so it makes sense to say, well, what are the biggest things? And let's actually focus on those.
Get the most bang for your buck, get that biggest payload. What are the things we can do to curb those risk factors the most? So that's going to be very exciting. So look forward for that coming out. What are we into November now? So we'll probably get that up. Looking to do that one by December, I would think. So excellent. All right, Dan, thank you for your time as always. It was a pleasure. And good night, everybody.
Take care, guys.